comrades. We are extremely happy from the All India Bank Employees Association that in tie-up with the Apollo hospitals, today we have started this health awareness program for our members all over the country. I need not introduce about the Apollo hospital because it is a well-known health institution in our country, and we have been working with them for quite some time. And recently, we requested them that particularly because in the house or in the workplaces, our people meet with some health contingency, particularly cardiac arrest, etc. And so we thought that we should have some first aid knowledge of how to help the people. So we talked to them, and they were very kind enough that they said they will arrange a lecture by one of the top specialists in this field, Dr. Dhavapalani. And we are very happy that we have Dr. Dhavapalani with us today in this program. About his qualification, etc. If I start here in Tamil Nadu, it will go to Ireland, London, like that, very far away. He is very experienced, very knowledgeable, and is a senior doctor in Apollo also in this particular field. We are extremely happy that he has agreed to give his time to our program. I also welcome all our comrades and friends and their family members for joining us this program through our YouTube channel. Later, this will be, of course, permanently in our YouTube, Facebook, etc. And we shall be having a series of lectures on different programs. Next will be about the breast cancer awareness program for our lady employees. Like that, we are going to have series of program. So once again, I'm very happy to welcome Dr. Dhavapalani. I am very happy to welcome all of you for the program. I am very sure this will be very interesting, educative, and helpful to all of us. Thank you very much. Over to Dr. Dhavapalani.
Thank you for having me here, sir. And thank you for your kind introduction. I thought in this brief 30 minutes or whatever length of time we have, I will talk about the common emergencies people face and how perturbed people can be when they are faced with such a health emergency. And I'm going to try and explain what can be done from the patient's perspective and how you can help yourselves better. So we'll start off with some common emergencies. The most worrying emergency somebody might have or perceive to have is, am I having a heart attack? So I would start off by saying what simply a heart attack is and what a patient can do. It usually presents with chest pain. Chest pain could be from innumerable reasons, but the pain that's from the heart is usually a pain that is in the center of the chest rather than to the left side of the heart. So it's usually central, and it's like a weight or a pressure on your chest. If you ask me, I'm sure all of us have experienced pain that is from your heart. Say if you were running non-stop for whatever reason for a length of time, or if you're climbing several flights of stairs and you get this heaviness in the center of the chest, you feel like some weight being put on your chest, that is classically a cardiac chest pain. That's a pain from your heart. Of course, it's always a case of demand versus supply. You're overworking your heart's capacity to pump up oxygenated blood, and that's when you feel this uncomfortable feeling. So you stop, and that goes. That is normal. But however, in a patient who's having a heart attack, he's having a block, the blood supply to the heart muscle per se. Heart is nothing but a ball of muscle cut into 4 chambers. So that when it is not receiving adequate blood supply due to a block, then they perceive pain, they suffer a heart attack. The consequence of which is that bit of the heart dies, heart muscle dies. So that can have disastrous consequences for the patient. The heart, which is supposed to pump like this, can go all haywire like this. When it is just doing this, it doesn't give a reasonable output or a meaningful output. So all this can lead to death. So that's why we all fear heart attack. So most often when you have heart attack, when it is a small area that is devoid of blood supply, then you will only experience some pain for a bit of time, and then you may feel back to normal. So in any case, you have a certain length of time to reverse this situation, to restore the blood supply. So in medical terms, it's called reperfusion. There are two ways to do it. One is to pass a guide wire, a catheter, a balloon, and dilate it and leave a stent. A stent will restore the blood supply. The other is to try a medication, a strong drug which will burst the clot. The second choice is not that effective. The preferred version is to pass a catheter and leave a stent. That's called angioplasty. So ideally, it should be done each minute that you delay. So more muscle fibers, more muscle from your heart is dying for want of blood supply, for want of oxygen. So the sooner you get it done, the better. So as a patient, what do you need to do? The moment you have these uncomfortable heaviness in the chest, if it doesn't shift in 10 minutes, it doesn't go away in 10 minutes, then you need to be reaching a hospital as soon as possible. You're better off calling an ambulance in these situations rather than being driven by somebody else, or even worse, is trying to drive yourself to the hospital. Simply because they can monitor you en route, they can pre-alert the hospitals so that they will be ready with the cath lab and all that. And as soon as you come to the hospital, most organized good hospitals will get you into the cath lab, say within half an hour or so. So to identify it's a heart attack, and for you to move into the cath lab, it will take about half an hour. What can you do as a patient yourself? You need to stop exerting yourself. If you were in an argument, if you were really walking or exercising or doing something that is really exerting yourself, you need to stop that. Number one. Number two, you need to, if you have an aspirin at home, ideally a dissolvable aspirin, Disprin. So you need to you can take an aspirin. So that doesn't, what does the aspirin do? It doesn't allow the platelets. Platelets are the cells that form a clot. So the aspirin doesn't allow the platelets to stick to each other, and it breaks the clot. So aspirin is an antiplatelet medication. So that works. So the sooner you take it, the better. So you can dissolve a Disprin and you can take that, and you should have called an ambulance. 1066 is Apollo's ambulance service. So you can call an ambulance, and you need to get to the nearest appropriate facility rather than the nearest facility. Most often people have a tendency to go to a nearby hospital. If you go to a clinic or a 20-bedded small hospital where there is no cath lab facility, it puts them under pressure, and you won't be getting the ideal optimal treatment either. So you need to know which is your nearest appropriate facility where they'll be able to do reperfusions straight away. So where they'll be able to reperfuse your heart straight away. So this is about heart attack. We've had many situations. I can recount so many situations where they come the next day, they come after 12 hours, they've taken Gelusil, they've tried Vicks over the chest. We've had all kinds of things. We've had patients who've been brought dead after having suffered from indigestion. So you can never take it lightly. You need to come to the hospital to have it checked. So what are the pre-warning signs? So if you are a gentleman who goes for a morning walk, after 15 minutes of walking, if you have a heaviness or a pressure or a band-like sensation in the chest, then you obviously have to have yourself checked. So they're just telling you, your minimal amount of exertion is not something I'm able to cope with. It's what your heart is saying. So I have to pump harder, thereby my oxygen demand is more, which means there is a narrowing. So you need to have that fixed. Yeah. So who's prone? Diabetics, men in general, there are modifiable risk factors, non-modifiable risk factor. Your gender is a non-modifiable risk factor. So men are more vulnerable. So are people who are diabetics, who have high blood pressure, people who have high cholesterol, and people who are having a very strong family history, meaning more than 2 people dying under the age of 50 with a heart attack, etc. These are all classed as high risk. So if you have any of the high risk factor, you're better off having a annual check for your propensity to develop a heart attack. This is about heart attack. I'm going to quickly talk about what perturbs people more. The next common thing is a bleeding wound. Any cut wound that people suffer and they see blood, they are really anxious. It's completely the opposite of what I was talking about. The heart attack is a real emergency, but people tend not to really realize it's a time critical emergency. Whereas with a cut, when they see blood, they panic, and I'm almost certain all of you will reach out to a hospital in no time. But this is a situation where you can take your time. All you need to do is, wherever the bleeding wound is, most wounds, majority, 98, 99% of them are compressible wounds. All you need to do is put a small piece of clean cloth, say a handkerchief or whatever, gauze or whatever you can lay your hand on, and put direct pressure. Persistent, firm pressure over the wound will stop the bleed, wherever it is. Some areas of a body are very vascular, meaning rich in blood supply. The scalp, the head, the face, your hands, palms. So these are areas which will really bleed much more than other areas. So all you need to do is put some direct pressure, and if possible, raise the part of the body which is bleeding. So you can, if somebody has got a scalp wound, you sit them up a bit. I mean, standing them up will make them collapse, but you can raise the head if you can on the bed. Yeah, and you need to be applying direct pressure. You can raise the hand if it is in the hand, for example, with direct pressure. And you will have ample time. All you need to do is maintain the pressure, and then you can reach the hospital in good time. Nothing will happen. You can, unless it's really an arterial wound, most often the external bleeding wounds can be compressed, and it will give you enough time to reach the hospital. That's about bleeding wounds. Now we will talk about another serious situation, which will be a stroke. A stroke is as we call a myocardial infarction, a heart attack. Whatever happens to the heart, we call it a heart attack. Stroke is also known as a brain attack. They used to use the term brain attack. A portion of your brain does not receive blood supply. It's the similar sort of risk factors, similar sort of pathological process that makes you have a stroke. Stroke is not something that is immediately perceived as that serious by some patients, simply because it's not painful. Yeah, with heart attack, majority of the patients will have a severe crushing chest pain. Whereas with stroke, since it's painless, people tend to ignore it. They will think, if they're not able to use their arm or the leg, they tend to think, oh, I might have slept awkward. I think it's just a bit of a funny bone, whatever. They ignore symptoms for a while. With heart attack, we may have up to 12 hours to salvage the situation. Sooner the better. I'm not saying you wait for 12 hours. You need to be, each minute counts in a heart attack too. But with stroke, we have much less of a time window, because the brain cells have a shorter lifespan. When they are cut off from oxygen, they tend to die much sooner. So what do you do for a stroke? How do you identify a stroke? So you will have facial asymmetry, a droop, or a facial symmetry is being lost. You're not able to use your arm drift, or leg weakness. So arm drift is when you ask them to put their hands up, one arm drops gradually or immediately. Yeah, they're not able to do it. So these symptoms, sometimes they may have difficulty walking, meaning they'll have the balance area of the brain, the cerebellum, is affected. They'll struggle to walk in a straight line. They'll tend to sway towards one side. Alcohol affects your cerebellum, and that's why people who are really intoxicated tend to sway to one side. It's similar. So if you have a balance area stroke, this will be the situation. So if you have any of these symptoms, either not being able to feel a part of your body or not use a part of your body, then you have very narrow time frame to get it fixed. So 15, 20 years ago, stroke was not a situation where emergency departments, hospitals will get too worked up about, because they are quite often all they could do was once they know there is a block, they would give them an aspirin and think about rehab. Not much was available by way of treatment till 2 decades ago. But now it's really, stroke management has grown leaps and bounds. So we could open up the artery in the same way as we do it for the heart. So they can remove the clot, what we call a mechanical thrombectomy. Even before that, they can use a clot bursting drug, a thrombolysis. They could do all of that. But then 85% of the strokes, 85 to 90% of the strokes are because of a clot blocking the blood vessel. But 10 to 15% of them are from the blood vessel being burst and there is a bleed. Yeah, so when the blood vessel is burst or it's blocked, either way, the remaining area, the supply area of that vessel is not going to receive oxygen. So that results in a stroke. If it is a bleed, we need to exclude that 15%. So we take a quick scan to see if it is a block or a bleed. So whereas with a heart attack, it's very easy. Quite in majority of the cases, we diagnose it with a history and a ECG, sometimes with blood tests. Yeah, but with stroke, we do need the scan to see if it is a bleed or if it is a block. The block is also known as an ischemic stroke. So if it is a block, the 85% of the patient population who suffer an acute stroke have the option of having a clot bursting drug or a mechanical thrombectomy, or one followed by the other. Quite often it's one followed by the other. So again, you need to be there with heart attack. Like I said, the time window is longer. Here, you have a maximum time length of 4.5 hours for a good number of patients. If it is a balance area or the other areas of brain, we may have a bit longer. But ideally, you need to be in the hospital as soon as possible, so that we need time to examine you, get a CT scan done, maybe even look at the blood vessels by doing a CT angiogram of the brain vessels, and then we would be able to administer treatment. So all this would take slightly longer than what it would for a heart attack. So with stroke, what people don't tend to realize is it doesn't just affect the individual, it affects the whole surrounding around the individual. If somebody is unable to use their arms, legs, they're not able to get out of the bed, so they would depend on somebody else to help them with their daily needs, even personal hygiene needs. So imagine being wiped by somebody else when they're aware of what is happening. That kills their morale, not just them, everybody around them. So in many ways, strokes, the treatments have evolved. There are many options these days. So we need to get them to the hospital much sooner. Is there anything that you can do for stroke at home like the aspirin? You can't, because you need to exclude a bleed first. So with stroke, all you need to do is make sure they're not having any secretions or their tongue blocking their airway. So if they're really less responsive, unconscious, then you need to keep them onto the side, roll them to the left side, and then get them to the hospital. Call an ambulance and bring them to the hospital. So that is with regards to stroke. The other thing people tend to worry about is patients having fits, seizures. it's again feared more than what people should be fearing about. It's a condition where people tend to really panic. Fits are most often self-limiting. 95% of the seizures stop on their own within 5 minutes. Whatever is self-limiting, people tend to believe in magic cures. So that's why the common perception of giving them an iron key or whatever helps is because it's self-limiting. And in any case, you try this giving them something to hold on to. It doesn't really work. So they'll stop on their own in majority of the patients within 5 minutes. So what can you do when somebody is spitting? Their tongue and the secretions that is pooling up will choke the airway. That is the biggest risk when somebody is having a fit. So you need to roll them onto the side. So make sure the secretions are finding a way out rather than pulling back in the back of the throat and causing an airway obstruction. So roll them onto the side, and then most often it stops, as I said. If it continues for beyond 5 minutes, then obviously you need to seek out a hospital. People we need to seek an ambulance to get them to the hospital. People who are known to have epilepsy, meaning repeated seizures, your neurologist might often give you a plan. If they are expected to have, say, several fits in a year, then they would give you a medication which you can apply in the cheek, inside of your cheek, so to stop the fit from happening. But again, it needs to happen under medical guidance. So that is with children with learning difficulties or even adults who have frequent seizures. They need to be having these treatment plans sorted out with their neurologist. So people with seizures shouldn't really drive, particularly if the last fit was within a year, and they should be in the company of an adult if they are in a swimming pool or going for a swimming anywhere. So all these they need to be careful about. So you don't have to give them an iron substance or iron key, but roll them onto the side and seek immediate transfer to a hospital if it is continuing beyond 5 minutes. That's about seizures. I think we'll have enough time to maybe talk about one other little thing, dog bites. So dog bites, particularly if it is an unprovoked bite, you have to get them treated. So you need to get 4 rabies vaccines. They've changed. It used to be 5 vaccines. You need to get 4 vaccine shots at day 0, day 3, 7, and 28. They'll give you the dates. But more importantly, the wound needs to be washed for 20 minutes. You can do that at home. In a running tap water, the dog bite wound needs to be washed. Why am I specifically talking about dog bites? If you contract rabies, meaning the dog has rabies and it has bitten you, and if you don't get yourself treated and you acquire rabies, that is a disease with 100% mortality, meaning it's a problem with no treatment. If you contract rabies, you will die. Yeah. So which is why it's important to prevent rabies after a dog bite. So wound wash is an equally important step. You need to wash it for 20 minutes and you need to get vaccines. All government hospitals, all big corporate hospitals will have a rabies vaccine, and you will also have what we call monoclonal antibodies or immunoglobulins injected into the wound. So the injections being given into the bite wound and at a different site. You'll have to have 3 further injections at subsequent days. So this is about rabies prevention as well. So I was given 25 minutes to speak. So I hope that's it. I'm going to wait for any questions that come up. Are there any questions from the audience?
There have been no questions at the moment, Doctor. Thank you very much for a wonderful and insightful session.
Thank you.
Yes, I think somebody was asking doctor about BMI. You can tell something about BMI.
Okay, so raised BMI, we have BMI of less than 25 is ideal. 25 to 30, we call them overweight, and beyond 30, they'll be labeled as being obese. So obesity, overweight, and being obese is a significant risk factor, not just for having heart attacks and strokes, as I said earlier. They cause significant problems with regards to arthritis, with regards to metabolic problems like diabetes, and so forth. There are numerous clinical diseases that obesity can induce you to have. So it's so following a diet plan, exercise plan is what you need to really think about. If it is, if you are morbidly obese and you've tried all these other options, then you need to see your practitioner. They may offer you other solutions, but not before trying diet plans and exercise. So once all those fail, then they may think about other surgical options, etc. But that is to be left for later.
Doctor, we have a question on sugar levels and the management of sugar levels through diet for a patient with diabetes.
Okay. So I think the South Indian population in particular, so we need to identify foods that are having a high glycemic index. Say when we eat rice, for example, or other direct sugars, why are we asked to eat millets and other fibrous carbs? Is because they tend to raise the sugar more gradually. So the foods, say if you eat a banana or have a juicy mango or have a bowl full of rice, all those are substances which would raise your sugar levels straight up. And we tend to have sugar in our coffee, tea, most of the beverages we have, all of which, and most of the juices that are packed juices in particular, they may have additional sugar. All these are food substances that will raise the sugar straight up. So we need to be mindful of how we plan our diet, and these substances will be rich in sugars, and that will surges in sugar levels will lead to erratic glycemic control, and that will lead to problems in the long run.
Doctor, we have one more question. How much exercise is normal for an adult in a scenario where he or she has suffered a cardiac arrest?
I presume they mean a heart attack. So I'm duty bound now to explain the difference between a cardiac arrest and a heart attack. Cardiac arrest is the final common pathway of all disease processes. Be it a heart attack, be it a major trauma where you've lost a lot of blood, be it huge blood vomiting. Many situations are life-threatening, but the final pathway in all such patients is your heart stops. That is the point just before death. So we label that as cardiac arrest. So if you are in a hospital environment, you have a 30% chance of being revived from a cardiac arrest. If you receive no support, if you've suffered a cardiac arrest, you're out of the hospital, then you're practically dead. So you are going to be dead. So that is cardiac arrest. Heart attack is when a part of your heart is not receiving blood supply. So now, presuming the question comes from a gentleman who wants to know if I've had a heart attack, so how much exercise I should be doing. So if you've had a heart attack and if you've had a stent placed, you are okay to exercise. If it's a single vessel disease in particular, you can resume normal activity. You can walk. What you can't do or shouldn't do is overexert yourself. Say going on a half marathon or doing something like that is not advisable. At least till they have done an angio and sorted out, are they happy that your other coronaries are all fine. So whatever disease blocked one coronary may be at risk of blocking the other coronaries. If the rest are all okay, then you can certainly exercise as normal. But you wouldn't be advised to carry out really strenuous exercises. Say a half an hour, 45-minute walk in a person who's had a perfect angioplasty and the rest of the vessels are okay is acceptable. I hope I'm giving some clarity on that.
Thank you, Doctor. What would be your final message to our viewers watching the session today?
Okay, so I think particularly with regards to strokes and heart attacks, so much can be done. So we South Asians are more vulnerable to get heart attacks. South Asians, that's because of many reasons, genetic reasons and our diet and the fact that we don't exercise as much as the Western population. For many reasons, we do that. So we need to be aware that heart attacks need immediate medical attention and we need to reach the hospital sooner. The longer you leave it, the lesser are the chances of you coming out unscathed. So yes, so if you do have a chest pain and it lasts more than 10 minutes, reach out the nearest appropriate facility, call an ambulance.
Thank you very much, Doctor.
Thank you.
Venkatachalam, sir, would you like to take over? Venkatachalam, sir.
I think, comrades, it was a very, very useful talk by our doctor, and we are extremely thankful to him. It was a very simple, understandable way, and I think we are now encouraged that we have some idea about it. We shall further continue such things, and because doctor is in Chennai, whenever we need, we can directly invite him also for some of our meetings where we can further talk. Thank you very much, doctor, for your presence, and thanks to Apollo for the kind help. And I'm sure all our viewers have been somewhat benefited by this program. Thanks a lot, and thank you very much for all of you. Thank you so much.